Good day, ma'am. I will be going to perform the donning and doffing of personal protective equipment. So, before the procedure, let us first remove our laces or jewelries. And, of course, don't forget to do a hand hygiene to prevent the spread of microorganisms. Okay? So, the first thing to do is to identify the correct size and gather the equipment needed. So the first equipment is the isolation gown for the protection of our skin and our clothing. Next is our N95 mask or the respirators to protect our respiratory tract from airborne infectious agent. Then next is our face shield to protect our face. And last, of course, our disposable gloves to protect our hands. Okay? So, the first thing that I'm going to wear is the isolation gown. Thank you. Then next is the face mask or the respirators. Okay? Okay, then let us proceed to the face shield. Okay, where it's on the bottom. Then lastly is the disposable gloves. Okay, so we are done in donning a personal protective equipment. We are now ready to enter the patient's room. The next procedure that I'm going to perform is the doffing of personal protective equipment or the removing of PPEs. Okay, so the first thing that I'm going to remove is my gloves. So always remember that our outside front is considered contaminated, and the considered clean is inside and at our back. Okay, so I will now proceed in removing my gloves. Then discard. And then next is our isolation gown. Then discard. And of course, perform the hand hygiene. And we are now ready to leave the patient's room. Okay. Then, the next thing that I'm going to remove is my face shield. So, we will remove it from the back. Move it away, then discard. And last is our face mask. Okay. So remove it from the back. Move away, then discard. Okay. So we are now done in doffing a personal protective equipment. So the last procedure, of course, is to perform a hand hygiene. So we are now done.